Welcome to the RMD podcast with me, your host, Dr. Deborah Durst, and my co-host.
Hey guys, Faraday Golembiewski, family nurse practitioner here at RevitalizeMD.
So today we're going to talk about IV therapy. This is one of the more popular terms lately, but we have been doing IV therapy since the office opened in 2019 for this location because we have an IV therapy room. But stay tuned for all of this one because it actually just talks about what your run-of-the-mill IV therapy lounges are versus what we have, which is customized drips that I have formulated myself with a pharmacy background and a very passionate interest in IV therapy as I learned it, because there's just so much you can do with it, but you really have to know the science. So anyone in our office now knows the science behind IV therapy, the individual ingredients, how to combine, customize, or go up on certain things, because people will research things related to IV therapy that are more customized, more kind of alternative, like high dose vitamin C for various conditions. And you can't get those at your standard IV places.
No, so make sure you listen all the way to the end to learn how we're different and what you should be looking for in an IV therapy clinic or lounge. I mean, now it's their lounges, their clinics, it's kind of interchangeable, but what you should be asking, what you should be looking for, because really IVs should not be a one and done. They're not all created equal. There are kits out there and then there's customizable. And in our office, like Dr. Durst said, she has formulated them so that our staff that is very well trained can add and delete and move things to customize it to patients. Mm-hmm. And we have drips that are not easily to come by that are very unique.
Yeah. Well, there's some things so it's increased in like popularity about 20% year over year. So every year they get a little more popular. But I think if you look at like the go-between, like the third parties in between us administering it and the pharmacies that are creating it, everyone's trying to make money on the run-of-the-mill, the IV therapy lounges. And so
the IV trend. What's the plug and play, right? So most of your lounges, like a wakeboard boat, it's a plug and play. Yeah. Hit a button, create a wake and surf it, all the same. Or you're serious about it and you need to customize that wake so that you can surf a little bit better. I obviously am thinking about the boat and the water because it's summertime here and I'm ready. But it's a plug and play or customizable, and everything in our office is customizable. But like Dr. Durst said, people want to capitalize on this IV rush and have that plug and play. There's no real thought behind it. It's a pre-mix that you just draw up and stick in a bag and give to somebody.
Yeah, and they're going to really, kind of minimize the cost of that to make money as they sell it to a clinic, and then the clinic wants to make money. So you're not going to get top-notch quality ingredients or the highest concentration of ingredients. So we have individual ingredients and we make every drip for the person in the office that day. We have some more popular drips, and then we have some things that are not easily found elsewhere. And then even an AD is another one that we do, and can customize. So there's lots of different things. But IV therapy, why has it gained popularity? So why is IV nutrient so more popular, more important?
What is IV therapy? Yeah. What is the difference between getting an IV and going and taking a multivitamin?
Yes. Or what is the difference between IVs and IV, like nutrient therapy? So you can get an IV when you go to the ER. Like you go to the ER, you're dehydrated, you're hungover, you're vomiting, you end up in urgent care or an ER. You're going to actually end up getting some IV hydration, but that is literally just fluid. That's hydration.
It's just to help your cells.
And it is, again, compatible with the cells. And it's what we call like an isotonic, so that it's compatible with cells, but it's still just fluid. It's just hydration. So you're not going to get any nutrients with it or any vitamins or minerals with it. And so to that point, why would we want IV nutrients versus taking orally, which was your question?
Yeah. So oral has a 20 to 30% absorption rate. So the gut is acidic. You're not going to get everything that you take in. So when you see your oral supplements that say 200% daily allotted value, well, it's accounting for your gut is going to ruin most of that before it's ever absorbed, where an IV is 100% available and absorbed. So it's the availability.
And that's on a good day, 20%, because your GI tract is, extremely inflamed most of the time. And so then you may not even get that. And then is the supplement that you're taking actually have that concentration of ingredients in that's stated on the label, because it's not a regulated, and we have a previous podcast that we've done talking about medical grade supplements. So lots of things that go into it, but
quality, quantity.
Yeah. And so this all started with like a Meyers Cocktail way back. And so that was just a small amount of fluid in an IV, in an IV route. And it was mainly for allergies and immune support. That was the start of it.
And it had some B12 in it.
Yeah. So energy, but like allergies, immune support. But it was really just a small amount in a syringe that they administered intravenously. So now we can do lots of different things with it, but it is immune support, it's cellular health, it's energy, it's detox, it's hydration.
It's skin and anti-aging.
Yeah. And it's, just liver detox all the way around. And then, of course, you can do NAD. So you can also do, and even the IVs without NAD, the IV nutrient therapy can also just increase mitochondrial support, which is your powerhouse of your cell and every cell in your body.
Or glutathione, which is a powerful antioxidant. I mean, really with IVs, it is almost limitless in what you can do.
Yeah. And it's 100%, like Faraday said, to the cell. Absorbed. And so when you do certain doses of IV vitamin C, some of that will concentrate depending on what your level and whether that's considered high dose. Some of that will concentrate in the white blood cell and last for a longer period of time. And so, but this isn't a one and done. You can do a one and done. So is it a hangover that you can do? Yeah. Have you had a pre-event? Are you going, are you doing some, significant mountain, bike event?
Are you traveling? Have you been on a plane? Are you post and pre-travel? That's huge.
Yeah.
So can it be fluff? Yeah, there are bags out there that are beauty bags that are help for skin brightening that are a little bit more, right, that fluff. They do actually help with skin brightening, but then there are some bags that are a little bit more medically derived that are working towards specific needs patients are coming in and looking for.
Yeah.
Like immunity or that cellular health.
Yeah. And I think that you brought up a key point with travel. I highly recommend that people actually do IV therapy pre-travel and post-travel, because you are in an enclosed, and you're in a electromagnetic hell, essentially, when you're in a plane and, flying, and then all kinds of germs. And so for immune support and decreasing your risk of infection, it's important.
Pre and post.
I love the whole fast food versus chef made. And that's the difference between, Faraday brought this up, and I think that's key, is that it's almost like taking the fast food version or your IV drip places and then having some place that customized it. So again, we do some trainings for offices that want to incorporate it into the practice, but we have no interest in actually doing something that is just related to an IV drip kind of place. Yeah. We want to work with doctors, providers, offices that really want to do a more comprehensive health. So customizing the drips, it took me a long time to put them together. I learned a ton. That was way back, 7 years ago. But there's just so much that you can learn, and it's exciting. And if you actually look at most diseases, again, inflammation and some kind of vitamin or nutrient deficiency. And so if you can just supplement it, it's huge. So what are the top ingredients that we would use for this?
So in our office, that can be a pretty extensive list, yes. But probably some of our most common one, probably the most common in almost all of the bags would be B12.
Yes. Yeah.
And that's probably across the board at any IV lounge. That's probably the most common vitamin placed into an IV bag.
B12 and B complex.
And B complex, yep.
Those two together. They're separate, we have them as separate ingredients, but those are important. Energy. Huge for energy. A lot of people are B12 deficient and B vitamin
40%
deficient.
of Americans are B12 deficient. 40%.
Yeah.
That's you might as well just say half.
Yeah. Yeah. And so really getting a shot of B12, it's not easily absorbed. And so having B12 in an IV or shot form is important. Vitamin C is a top one. And again, all of our drips outside of just a hydration drip has vitamin C, and high dose is considered anything with 25 grams and above. We have another podcast that we talked about with high dose vitamin C IV for surgical healing, which is huge. So if anybody has an injury undergoing surgery, should definitely be getting high dose vitamin C, which is greater than 15 grams in a bag. And then glutathione.
Glutathione's another big one.
Yeah. And we've done also, again, other podcasts talking about how that doesn't absorb orally and how you can take it in, a liposomal
form.
Yeah.
But IV's your best
IV's
for
the
glutathione.
best.
It really is.
Yeah. And so doing a shot, but IV, you get a higher dose and you get that detox, master detox in the body. And then,
magnesium, that's
huge.
another one, right? And that is half of Americans are deficient in magnesium and have no idea.
Yeah.
50%.
And even if you have a normal magnesium level, you still have an intracellular deficiency frequently. So it's not as if you're going to get too much. It relaxes everything. The GI tract, it relaxes you emotionally. It relaxes
It can help
you to
with
go to
migraines.
sleep, migraines, blood
Premenstrual
pressure.
for women, blood pressure.
Yeah. So it's huge. And again, IV it's great. So if even somebody is running a little bit on the higher blood pressure side, that will help with decreasing their blood pressure. Amino acids are huge. So we don't think about that, but amino acids for muscle building and for all kinds of cellular support.
Metabolism. I mean, aminos really do. They are our building blocks.
Mm-hmm. So in NAD, of course, we talked about. NAD can be done separately, and it's actually a very cool IV because what happens is you'll feel weird when you're getting it because it's intense. So
it's a pretty slow drip. So some people can go a little bit faster with that drip than others. It's not a race. It's not a competition because it can make you feel weird. It can be that tightness in your chest. It can be a little bit of shortness of breath. It can be rolling nausea. You just need to slow your drip down. So some people can drip over 4 or 5 hours where some have dripped 6 plus.
And you can use it for detox, for addictions. It's not what we use it for, although we do NAD in the office. So if somebody has one of those conditions, they can actually use it for that. And then it'll increase your NAD 100% in just a matter of hours.
And keep it elevated within that 6 hours, which is awesome.
Yeah.
Which is awesome. That's amazing.
Yeah, no, it's an awesome drip to do. So who is IV therapy for? So anyone that wants prevention, flying, immune support, overall wellness, cellular support, optimization, but everyday people that are just
I love
stressed
the
out.
everyday warriors,
Yeah.
your moms, your athletes, your CEOs, your shift workers. I mean, it doesn't discriminate. We are all worn out. We are all depleted. We are all trying to get those healthy meals in when we can, but none of us eat enough leafy greens and get the vitamins, minerals that we need.
And you feel amazing after. Medical support, migraines, fibromyalgia, anything that has inflammation in the body, it's helpful for decreasing inflammation. In fact, high-dose vitamin C is one of the best things for decreasing inflammation in the body, can get a inflammatory marker down very quickly.
Some for viral too.
Yes. And don't think that it's going to increase your blood pressure because it will not. Again, you're hydrating. So some people think if you get IV fluids and you have high blood pressure, it's going to, but it's not. It's flushing things out. It's detoxing and it's not going to increase because you're actually just filtering that through the kidney. And so, but there's a lot of science to back it. And, you can always have labs. And you also need labs if you're going to do really high dose vitamin C. And we really want to customize, then we need to do a G6PD to do that.
And I think one of the biggest things that's different in our office is that we do have medical oversight in our office. We have a physician that is also pharmacy, a pharmacist as well, educated, that has put these together. So a lot of these drip places you go to, it's a nurse. There's not, like I said, it's a plug and play. It's just pulling up a pre-made formulation, sticking it in a bag and giving it to patients. And there's not a ton of medical oversight present in the office.
And there has been, a case or two presented to us for support for bad outcomes in IV therapy lounges, not to make you nervous, but you can have reactions. You have to be prepped for that, and your staff has to be ready for that. So
sterility is a big thing, making sure the process is sterile, making sure that everybody is very aware of what can and can't go into a bag.
Yeah.
And the side effects of those.
Yeah, all the osmolarity stuff. Yeah. So, the office is very well trained for that. And so, again, if there's ever an office or somebody listening from a provider standpoint that wants to learn more about it, we definitely have that ability and training for those offices. Otherwise, just know that IV therapy should be as unique as you and customized to you, and that we can do at Revitalize.
We don't drip by default. We drip by design.
Yes, I love that. Yeah. And so definitely let us know if you've had any IV therapy and any thoughts, because we're here to answer questions and, again, willing to deep dive into anything wellness or sexual wellness.